I am Becky Bashir. Why are data sets and information management important? Here's an example. During assessment, the nurse determines the patient has shortness of breath, lower extremity edema, and weight gain. A new graduate nurse may not be aware these three symptoms together are very important. Using charting by exception, the nurse will have increased prompts on further questions to assess. This is critical thinking in action. The nurse will learn to put the pieces together with assistance of technology. Data is gathered and entered into the system using standardized technology, charting by exception, reviewing any previous submissions, and current test results. Educators need to incorporate electronic charting and information technology into the nursing curriculum. The students need to be comfortable charting by exception. Benefits: graduates on their first job will be successful because they have experienced electronic charting. The systems may be different, but again, standardized terms and core measures are across the country. This is how charts were stored prior to electronic charting. How much time would it take to review a patient's history and previous test results? How many paper cuts would you get? The Joint Commission has set standards on the importance of information management within the healthcare organization. All healthcare professionals and ancillary staff have access to patients' records to provide necessary treatment or intervention. The staff will all have up-to-date data at their fingertips. This is an example of electronic patient records. Areas include all disciplines having part in the patient's plan of care, from assessment, demographics, to progress notes. All communication between clinics and the patient, whether by email or through the system or on the phone, are also included. Core measures are required. They optimize patient outcomes. Barcode scanning, falls assessment, skin assessment, evidence-based practice, all improve patient outcomes and patient satisfaction. Charting by exception decreases the amount of time spent charting. Using within defined limits is critical to this process. Electronic records allow data to be tracked and trends identified. Using the patient portal allows the patient to communicate easily with the provider for non-emergent issues, set up appointments, request refills on medications, and ask questions. Landlines are still used today, but many people do have a smartphone, tablet, or a computer. People have access to multiple websites, and the nurse must be aware of this fact. And even though the patient can find the information, it doesn't mean they understand what it means to their own health. Nurses use websites for procedures. Many hospitals now have a deal with companies for the nurses to only use their products. Nurses can access websites on their own, also for credit. Safety and quality go hand in hand. Never share your access or leave the computer open. For safety and quality, comply with barcode scanning. Following these steps will increase safety and ensure quality. The benefits of data sets and information management are without a doubt worth the time spent to improve patient outcomes, quality and safety, and increase patient satisfaction. Sometimes you may be frustrated while learning the electronic charting system or researching information for school. Hang in there.
Created using Powtoon.